We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
The COVID-19 pandemic in Malaysia has far-reaching social consequences on the country that went beyond the spread of the disease and effort to eliminate it, including the registration of birth, deaths, and marriage, mass gathering, education, and sport activity. The restriction of births and deaths during the movement control order MCO will be allowed to be delayed up to 19 days from the date the MCO ends. The Ministry of Home Affairs had decided that those who need to replace their lost My Card identity card could make an appointment with local national registration department. Education has affected by pandemic COVID-19 also. The Ministry of Education of Malaysia announced that all school extracurricular activity has to be suspended. Many universities and colleges were forced to make swift change to online teaching when MCO was imposed. But this comes with several challenges. First, even if students and lecturers can get past the technical difficulties, one cannot assume that all students enjoy unlimited internet access or possess laptop or desktops that allow them to attend online classes freely. Second, the coverage and speed of internet also very dependent on one budget and location. Hence, it is likely that some students, especially those who reside in rural areas, do not enjoy internet access or sufficiently good internet access. The way most of their peers who live in urban areas do, these students run a high risk of being left behind if classes are entirely conducted online. The COVID-19 pandemic has many impacts on health in Asia beyond those caused by the COVID-19 disease itself. It has led to a reduction in hospital visits for other reasons. The impact of all this special distancing policy and the uncertainty of returning to normalcy directly and indirectly impact the community's social life and mental well-being. Those interim actions such as MCO or lockdowns, physical distancing, and quarantine have reportedly lead to high fear, stress, and anxiety among individuals. A recent review found women, younger individuals, those living in rural areas, those with lower socio-economic status, those at higher risk of COVID-19 infection, and longer media exposure associated with higher level of anxiety and depression. Paying attention and taking measures to prevent mental health problems and post-traumatic stress syndrome, particularly in women, is already a need. The COVID-19 pandemic is ongoing global pandemic of coronavirus disease 2019 COVID-19. COVID-19 caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. The novel virus was first identified from an outbreak in the Chinese city of Wuhan in December 2019 and attempted to contain it thereafter, allowing it to spread across the globe. The World Health Organization (WHO) declared a public health emergency of international concern on 30 January 2020 and a pandemic on 11 March 2020. The COVID-19 pandemic in Malaysia is a part of the global COVID-19 epidemic that is still going on. With over 2,700,000 verified COVID-19 cases, over 13,000 active cases, over 31,000 deaths with over 41 million tests as of 3 January 2022. The country is now placed third in Southeast Asia COVID-19 cases and third behind Indonesia and the Philippines. As of 15 January 2022, the pandemic had caused more than 323 million cases and 5.53 million deaths, making it one of the deadliest in history. Since January 2020, the medical response and preparedness to the outbreak in Malaysia have been overseen by the Director General of Health, Nur Hisham Abdullah, under the Health Ministry of three successful governments by Mahathir Muhyiddin and Ismail Sabri cabinets. The first cases in Malaysia were confirmed on a traveler from China in Johor via Singapore on 25 January 2020. The COVID-19 pandemic in Malaysia has a significant impact on the Malaysian economy, leading to the devaluation of the Malaysian ringgit (MYR) and the country's gross domestic product decline. The pandemic also adversely affected several key sectors including entertainment, markets, retail, hospitality, and tourism. Such shortage in goods and services, many businesses had to cope with social distancing and lockdown restrictions which affected their operation and revenue. The pandemic also drew attention to workplace safety and the exploitation of migrant workers working in Malaysian industry. Without the means to earn an income during lockdowns, many cannot feed themselves and their family. For most, non-income means no food, or at the best, less food and less nutritious food.
For this session, we will see a view about the impact of COVID-19 according Malaysians, who have guessed that the whole entire world will be hit by a pandemic crisis that will change the life of everyone in 2020. Most countries have imposed border closure and movement control orders or MCO in their residents to reduce the spread of COVID-19 epidemic. The effectiveness of these mitigation measures is heavily reliant on the cooperation and compliance of all community members. As Malaysians, we need to learn the knowledge, attitudes, and do some practices regarding COVID-19. In the face of these new life changes, people are advised to follow to the 3C and 3W guidelines. Among of the steps that can be taken to avoid 3C, which is firstly, C for crowded space. By avoiding crowded space, it will be difficult to people to maintain social incarceration. Secondly, C for confined or enclosed space. Confined space with poor ventilation are known to be hotspots for COVID-19 transmissions. And lastly, C for close conversation. By avoiding close conversation, people can maintain social distancing. For addition, to always maintain the social distancing, people must always maintain the gap between 1 to 1.5 meters per person. So, what are the roles of Malaysians to prevent COVID-19? The main role is the government. The government must educate the public about the novel coronavirus of 2019. Besides, the government must provide up-to-date information on the spread of the coronavirus both within and outside the country. The government must also provide facilities for dealing with outbreaks such as the laboratory infrastructure for testing the virus and screening facilities at neighboring countries' airports or borders. Secondly, the roles of community in Malaysia. Malaysians must adopt a new culture or a new normal life, as frequently emphasized by the government's top leadership. People must pay more attention to SOPs, particularly in the practice of the social imprisonment established by the National Security Council or NSC. Lastly, the roles of individuals. Getting vaccinated is compulsory in the fight to eradicate COVID-19. Vaccination also reduces our chances of infecting others with COVID-19. Starting from ourselves, SOPs can be successfully implemented. In conclusion, despite the fact that the number of daily COVID-19 cases is decreasing and regulations are being relaxed, we must remain vigilant and continue follow SOPs. We will live in this new normal as long as we do not carry out the responsibilities and follow the guidelines that have been issued. There is a chance that the number of daily cases will rise again, and it is possible that the MCOs will be enforced again in the future. Always take the first step and consider that the MCO news as it will assist us in taking care of each other.